I reckon, Tom, if we get started and then those that are wanting to join can hop on and I'll let them in.
Okay, great, thanks. Hi everyone, thank you for joining me today. So today I'm going to talk about the ward volunteering program we set up at St George's. So my name's Thomas Yip and I'm the head of financial reporting at St George's University Hospitals. So for those joining sort of later, the slides will be sent out after. And if you have any questions throughout, please do sort of raise your hand or use the chat box to ask questions, or you can sort of ask at the end. I'll just share my screen. So yeah, as I mentioned, so today we're going to talk about the volunteering program I set up at St George's, and this was to spend time on wards at meal times, helping serve meals and feed patients, and also chatting to patients. So finance staff often have little or no contact with patients, whilst all staff in the NHS have a strong motivation to work to improve the quality of patient care. It can be easy for us to forget this, and all we see are numbers and spreadsheets. In a survey with the finance department, 87% said that they would like to spend more time in clinical areas and interacting with patients. According to the 2022 adult inpatient survey, 17.2% of patients never get help from staff to eat meals. And as you can see from this table, this figure has risen over the last few years and is likely due to the nursing pressures and also staff shortages on the wards. So I've previously had experience of volunteering on the wards. So here's a sort of article from me. So I joined the NHS back in 2013, and in 2014, so at a previous trust, I used to volunteer after work on the wards, and I helped serve meals to patients. And this was an extremely rewarding experience, and it's definitely had an impact on how I am as a person and a leader today. So I volunteered on a geriatric ward when I first began. And when I first began, I was only expecting to hand out the meals to patients. However, it soon became apparent that many of these patients actually needed help being fed as well. So I was very happy to help wherever I could and contribute to a positive patient experience. A great part of the experience was also talking to the patients. So many of the patients had been there for weeks and did not have visitors often, so I'd really enjoyed just chatting to them and providing some company. The patients were often surprised to learn that I was from the finance department, but were very appreciative of the conversations we had. I've also been fortunate enough to spend quite a bit of time shadowing clinical areas, and I'm really inspired by our staff and patients every time I do visit. Even just walking through the hospital to go to Pret or to the canteen. So whenever I see patients around, it really does strengthen my motivation for working in the NHS. It would be great if through this volunteering program, if sort of more and more finance staff were able to share these similar experiences. So based on feedback from the department, the nursing staffing pressures, and from my own personal experiences, I set up a program for finance staff to help spend time on wards at meal times. This was to serve meals to patients, feed patients and chat to patients. This was offered to all finance staff who wished to volunteer. This program was easy and quick to set up. It took around sort of 2 to 3 months in total. The steps involved seeking support from the various stakeholders, who are the senior nursing team, the senior finance team, and the finance staff volunteers. Staff also had to complete relevant forms from voluntary services and complete the necessary training. Lastly, staff had to be assigned to wards on preferences, based on their preferences. So around 40 finance staff signed up to the program sort of when we initially first launched it, which was around 25% of the department. So one challenge, I guess one sort of challenge or sort of worry that we had before was there would be a low participation as staff do not have the time or do not want to use up their free time. But I believe, so we had support from the senior team and sort of also telling staff about my own sort of personal experience. I think that helped helps I guess, yeah, cause staff to sign up. And this is just like an example of the template we use to help with staff, with help assigning staff to wards, where staff listed their preferences sort of for days, times and types of tasks. Then I guess you can see from the list there's like a variation, yeah, a good variety of sort of staff who volunteered, some even sort of on weekends, and lunch and dinner times, and this has sort of helped us set up the program. So to set up the program, we needed, if we look at some resources, so to set the program, we needed support from the senior nursing team to allow finance staff to spend time on wards. Some conversations that I had with the heads of nursings, or with some of the heads of nursings, 100% of them were fully supportive of the idea of the proposal at the time, and thought the wards would benefit greatly. This program required support from the senior finance team. So finance staff would potentially spend an hour on the wards each week over lunch. So this time would need to be protected. And this program was approved at our finance department, Dragon's Den. So I guess that's maybe another idea if you're looking for sort of some ideas for training development. We have like I can talk about that another time, but like a Dragon's Den we had in our finance department to propose sort of, I guess, like innovative ideas such as this one. Also, we needed finance staff to be willing to commit to the program. So in an initial survey with the finance department, so 40, I sort of had a survey saying who'd like to volunteer on the wards, and 43% of them said they would sort of volunteer to help out. Also, we had to work with the voluntary services team to ensure that all the relevant forms were completed and training was provided. And lastly, this was implemented at no additional cost to the trust. So in terms of the benefits, so mealtime plays an important role in the recovery of patients. And I guess I think that there has been lots of research sort of looking into the recovery of patients and how that is impacted by the meals, by having sort of good meals. And across St George's and the country, there still can be significant improvements made. So with this program, finance staff assisted with feeding, and they also provided companionship to patients, and just sort of keeping the patient's company can help with the recovery. So as a finance department, we had a really great opportunity to improve the patient experience and improve the quality of patient care that we give. This program frees up time for ward staff so that they can provide care elsewhere. So I was once told by a head of nursing that they cannot meet over lunch as they're too busy serving meals to patients. So although this is an important duty, this shows that mealtime is a very busy time for the wards, and all the staff are involved to cope with the workload. So the ward staff really appreciate any extra help they receive. So freeing up time for the nurses has allowed them to focus elsewhere and provide care to patients that may benefit more from their nursing skill sets. So volunteering has had a big impact on the motivation and satisfaction of finance staff. So all of us want to do what we can to improve the quality of patient care, and I think a great way of doing this is by interacting directly with the patients themselves. In our day-to-day role, finance staff are sort of always demonstrating the trust values of excellent, kind, responsible, and respectful. Volunteering on the wards has allowed staff to display these values even further when caring for patients. The volunteering program has had a positive impact for the finance department and improved our presence across the trust. So other staff in the hospital sometimes think that finance staff just we're here to sort of save money by cutting costs. So the program has showed others the caring and compassionate side that all finance staff have. This program can also be easily expanded to other departments in the trust, and there have been initial discussions to expand this. I guess not even in the trust, I guess, across other organizations as well. It can be easily sort of expanded. So here's just a couple of examples of some feedback from finance staff who volunteered on the wards. So I won't go through all this in detail, but you can read it on the slides after. But as you can see from the feedback, it's been it's been a sort of a very positive experience, and especially for myself, sort of volunteering the wards. So as mentioned before, when I first started in 2013 doing the volunteering, and I still sort of remember my sort of first days on the wards and speaking to the patients. And as I sort of said, it's definitely sort of shaped me as I am, and shaped me how I am as a sort of a person working in finance in the NHS today. So yeah, please do have a sort of read of the feedback when you do receive the slides. So I guess looking back on the program to sort of see sort of what went well, what we could do better. So I think it's a very simple idea. The program is a very simple idea, and it's quick and easy to implement, and it can be set up at no additional cost. So the feedback, so as you read just now, the feedback has been very positive from the finance staff, and also the ward staff. So whenever there are nursing pressures, I guess lots of acute or lots of trust women have nursing pressures, and often the sort of chief nurse contacts the finance department and asks the finance department who can sort of help out on the wards, or sort of an ED who can sort of help just serve drinks to ED. And I guess when there's industrial action with the nurses, the finance staff often ask first. So again, that goes back to building up the sort of staff presence in the trust of finance department. I think the finance department at St George's have built up like a sort of strong reputation in sort of being there to sort of help out when the clinical staff need help. So one challenge I have found is so just I guess it's ensuring that the volunteers continue to volunteer. So I guess we especially sort of after the Christmas period, or after busy periods, everyone's busy with sort of year end. The numbers did drop, and sometimes I guess if you don't go for a few weeks, sometimes they sort of do struggle to come back. So I guess just trying to think of how we can sort of maintain this program to make sure that the sort of numbers don't just drop and people don't return. So things like maybe having sort of regular feedback sessions with the volunteers, or sort of could help prevent this. We could also work more closely with the sort of voluntary services team, even though so they're sort of really handy in making sure so we had all the right forms completed and things like that. So sometimes as volunteers, we sort of just turned up on the wards and no one's expecting us. So sometimes it can be always a bit awkward, or just if you sort of feel like you're a hindrance when no one's expecting you. So working more closely with the voluntary services team would sort of help with that as well. So if you're not based in an acute setting, I guess just definitely you could sign up with your local trust's volunteering program, or sort of get in touch with contacts who are sort of a nearby acute provider. Like if you're at sort of Southwest London, definitely very happy to contact myself, and you can sort of we can arrange it easily. So just to sort of conclude, so I think the finance staff ward volunteering program has had a really positive impact across the trust. And sort of at our peak when we first started, we had as a finance department, we were able to provide an additional 40 hours of patient interaction each week, and that was great to do, which meant that I guess an additional 40 hours of patient care was provided by nurses elsewhere. So patients, ward staff, finance staff, the finance department, and the trust have all benefited greatly. Thank you very much. And are there any questions about the proposal or about the program? Sorry.
Thank you, Tom. I think that's a really good program. If we take any hands, or if anyone wants to put anything to the chat box, please feel free to. But I can see that Stephanie's got a question if you want to come in.
Yes. Hi, Thomas. Can you hear me?
Hi, yeah, can hear you.
Hi. We obviously don't work on the same site as our trust. So we're sort of 10-15 minutes away in separate offices. So how would you then dedicate, I'm just asking for your opinion, because we were trying to get some time where we were, because not everyone's on site all the time. So we've only got one day where we're on in the office at the moment. I think they're trying to go to 2, but would you then say have one day of that month, so one day of those 4 across the month, and have that dedicated to trying to get to site, or would you say another day? Would you recommend another day where it's sort of dedicated to the ward volunteer, or like helping out around the trust and doing some community work. And did you have to go through any sort of training for infection control or anything to do with that? And how easy was it to get the trust on board with doing it? Sorry, that was a few questions into one.
Yeah.
I'm so sorry.
So I guess definitely firstly, like having the support from the senior staff. So having I guess our CFO, deputy CFO, I guess having that sort of support sort of, I guess, follows through to the other teams, to the other managers, and having them sort of be willing to say, yes, like we'll need to travel to the site. That'll take maybe 15 minutes, travel back, that'll take another 15 minutes, and then spend an
Yeah.
hour, I guess, in your lunch as well. So it could be like 2 hours you spend outside of, but I guess, like maybe, I guess hopefully we'll have a bit of a quieter times during the month, maybe like spend during the sort of the quieter periods of the month. You can maybe sort of spend it there. So I guess not every week, maybe just like twice a month when it's quieter,
Yeah.
travel to the hospitals and be willing to spend that time. Or like I know a few of us, I guess I wouldn't tell anyone to sort of use their outside of working hours, but some people did go after work. So after they finished work, they went. So I think meal times tend to be quite early, sort of 5:30 or 6 p.m. So after work, they travelled to the hospital, and then sort of went home from there. Or I guess if you have any, I guess you probably don't have any desks on the hospital site, maybe, or if you did have sort of hot desking, sort of work with, I guess, just talk together, try to arrange with another team or another department if you could have a few desks for when people do come across. So you could sort of sit there and do some work.
Yeah.
And what was your, I think you had a question after that.
The last one was the infection control, and was you needing any training, or
Yes, so we had training with the heads of nurses, I guess the matrons, the sort of ward managers, the nursing staff in the wards. We had like a sort of quick training session, each of us, before we started on infection control. Yeah, we did do that. And I think going through having the support from a voluntary services team as well, just to make sure that all those sort of the sort of like infection control training, all of that's ticked off as well. I guess that's important before you volunteer. So that helped as well.
Okay, thank you.
Just in case something else comes through. Oh, Karen, if you want to come in.
Thank you. No, I think it's brilliant, but I'm kind of like the similar as Stephanie, is that we're miles away from the main hospital, but also I'm trying to think about maybe, as you say, about whether you think about doing something on meal times, or maybe doing something on specific days when say like Mondays or Fridays, around, when wards are particularly busy, as maybe that's a better way of kind of targeting time to help. I don't know. I suppose it's just that I've just had the email today to go. We're about to go into what our escalation message, things now, because it's super busy, and I'm just wondering if I think we did have a similar scheme, not necessarily the finance department, but for all non-clinical staff to volunteer on wards, but it seems to have petered off. So I think it's interesting, as you've said, about how to encourage people to stay longer. But I'm wondering if your spreadsheet, once it's on the spreadsheet, we kind of, it encourages people to think, oh, I'm written down on a spreadsheet, so I must do it. But no, it's really, I think it's really good to see, because I think there's a thing about volunteering, isn't it? The benefits are for you as a person, in terms of why you're doing the job that you do, as well as to the kind of the patients, and that you can feel that you're helping out your teams. So it's brilliant. Thank you. It's given me lots of ideas to think through.
Thank you. Yeah, I think just like, so I guess often like ED, when there's pressures in ED here, we sort of go during the middle of the day, not necessarily meal times. We go at sort of 11 o'clock, or even just like serving drinks, serving tea and coffee, water. That's what the finance department do when we go there to help. So I know we sort of, all sort of, we've all got busy roles, but when we can find like even that would take maybe half, I guess if you're located near like half an hour, you can spend an ED just serving tea and coffee, or on the wards as well. I guess you can serve tea and coffee during the mornings or afternoon. And yeah, like I think in our St George's, we're sort of always encouraged to, if we can, sort of spend time with the services, go to theatres if you can, or spend a day there. So I think definitely that patient interaction and just seeing what happens rather than sort of us being sat behind our screens on Excel spreadsheets all day. For me as well, but definitely it does sort of help with that motivation and satisfaction.
Thank you. I have a question if I may. Oh, actually, no, we'll go with people actually attending. Bethany, do you want to come in?
You can jump in before me, that's okay.
No, it's okay. Mine was just, no, you go first, and then if we have time, I'll go.
Yeah, I think it sounds like a really, really great scheme, and really keen to cascade it wider. I suppose I would ask, what would be your advice to somebody new who's first going out to volunteer on a ward? Kind of what things would you suggest to them for like their first time?
So I guess just I like, yeah, to be honest, like it can be sort of a bit nerve-wracking for me. You know, sometimes you turn up, they think you're like, oh, you're like a doctor. They sometimes mistake you for like a doctor. You're there, just turn up, and just to sort of, I guess, like just be comfortable, like chat to all the staff, like I guess you'll be helping the people serve the meals, chat to all the sort of catering staff, and just get comfortable with everyone, and do sort of, as I said before, like sometimes you turn up, no one's expecting you, just maybe go there a few days before just to chat to the staff there, the sort of the ward managers, the receptionists, just so you can get comfortable with your surroundings, so you're not sort of there on day one looking lost and sort of don't know where to go. So yeah, definitely just, I think it's just at the end of the day, once you start talking to the patients, and you can sort of really feel that they like, I guess sometimes a lot of our elderly patients are here for a while, they don't have anyone to chat to as much, or no one's visiting for a while maybe. You sort of, once you start chatting to the patients, you do get really comfortable, and I guess it's just, yeah, it's always nice to chat to people and feel like you're really helping them sort of in their recovery.
Lovely, thanks very much.
Was there any other question? Mind if I ask you just a quick one?
Yeah.
I'm sure you might know that we the sort of stuff that we put on, but we do regular events called Demystifying NHS Finance. So breaking down the barrier of finance staff and people who are like nursing staff to people who are actually in the wards and spending the money that I guess you kind of find for them. Have you received any type of feedback from those that have been volunteering around if it is actually helping them maybe mystify that kind of gap or something?
Yeah, so like I've had feedback from people who've gone in the wards, and like often like nurses start asking about like their own sort of personal finances, and say like, I guess they think we're like sort of financial advisors, they sort of ask you for sort of personal financial advice sometimes. So I think it definitely has sort of created like a sort of a much stronger bond, and as I was mentioned in presentation, sometimes people just think of finance as sort of the people here to save money and tell you to stop spending money, but I think, yeah, definitely just sort of, I guess they're always surprised, not surprised, in a good way, they're sort of surprised to learn that like, oh great, finance here to help. And it's definitely sort of helped like, and we do have conversations, so we have sort of certain people have built up relationships with the people who do spend the money, and sort of had follow-up sessions, like following the building those relationships, they've sort of asked for finance training as well after that. So it definitely has built some good relationships in the trust.
Yeah, that's something else I was going to ask about. If this sort of program could be reversed, so those that you've gone in and you're from the finance department, I'm sure they're interested in what you're doing. So
Yeah.
is it something that could potentially evolve to them the other way around, so everyone kind of gets a bit of their hands in all the pies around the hospital?
Yeah, definitely. Yeah, we do have sort of, I guess from my memories of maybe like one or two people have asked to spend time with the finance department. So as you said, of like shadowing, they've shadowed the finance department for a day, for a few hours. So it definitely works sort of both ways. And I think like I guess the finance department here is quite like we sort of enjoy our training, and we're always happy to have people over as much as possible.
Perfect. Is there any other questions from anyone else? No. All right, if we wrap up then, that'd be the end. I will circulate all the slides to those who attended, and the recording will be up on the website as a resource if anyone within your trust wanted to have a look at the presentation today. But thank you for your time, Tom. Really appreciate it, and it's a really good program. It's really, really interesting.
Thank you, and yeah, please do like my email's on the presentation. Do get in touch if you're going to set up the program yourself or want to sort of get more involved. Please do get in touch with myself, and happy to support in any way.
Perfect. Thanks, Tom.
Thank you. Thanks everyone.
Thanks, everyone.